Being sick or injured in remote Australia can mean a costly medical flight to a major hospital. New research by Flinders University could reduce the need for evacuation, with more illnesses being diagnosed and treated locally.
This machine, known as the iStat, can test for a range of illnesses, from heart attacks to kidney failure. In remote areas, it can mean the difference between local treatment and medical evacuation. Flinders University has been given a grant to study its clinical and cost effectiveness, focusing on chest pain, renal failure and acute diarrhoea.
The earlier the patient can be diagnosed, the treatment can be started immediately, and the early intervention with treatment can result in a much better outcome for the patient in the long term.
The iStat needs just basic training to operate. With a drop of blood, remote clinics can quickly determine the seriousness of a medical condition. Brooke Spaeth has trained people in the technology for years, but experienced it firsthand after a car crash in remote Australia.
They were able to perform a test on the iStat immediately and see how stable I was and beginning to treat me based on those results. So I've been the trainer and I've also been the patient.
Northern Territory medicos are watching with interest. Up to 6 people a day are medically evacuated in the Territory, each lift costing more than $10,000.
This research will enable us to get some numbers behind those assumptions and make our thinking a little more accurate as to what we should have in remote communities.
The research will focus on 6 Territory communities.
It will enable the government to have clear evidence to be able to potentially use this technology more broadly throughout Australia.
Results are expected within a year. Leah McLennan, ABC News, Adelaide.